Isolated anthrax spores. Bacillus anthracis is the causative agent of anthrax, a serious and often fatal disease of wild and domestic animals. It produces endospores. When endospores are inhaled, ingested, or come into contact with a skin lesion on a host, they may become reactivated and multiply rapidly. Many of the symptoms that the isolated anthrax spores produce are pulmonary respiratory infection in humans initially present with cold, flu-like symptoms for several days, followed by febrile and severe and often fatal respiratory collapse.
During harsh conditions, the large rod-shaped bacteria that cause anthrax develop into spores that can be released into the air and inhaled. Inhaled spores are swept into the trachea, which divides into the bronchus. Because of their small size, the spores are carried into smaller and smaller bronchioles, eventually reaching the tiny alveolar sacs of the lung. In the alveolar spaces, immune cells called macrophages engulf the spores and attack them with enzymes. Although some spores are destroyed, many others survive the immune attack. The surviving spores travel through the lymphatic system and accumulate inside lymph nodes in the chest. After a period of time, the spores will germinate and grow into full-fledged anthrax bacteria, which replicate within the lymph nodes.